Well, coping with knee pain can make everyday tasks seem impossible. Surgery is an option to replace the knee, but that requires weeks of downtime and physical therapy. Action News anchor Margot Kim shows us a new therapy that's surgery-free and can get patients back in action without the pain.
Gilbert Cano can rack up the miles on a stationary bike and tackle almost any other exercise he loves to do because his knees are almost like new.
I used to wake up at night and the pain in my knees.
Osteoarthritis was so bad for the retired Fresno machinery repairman, it kept him up at night and kept him away from everyday life.
The thing that bugged me the most, I couldn't do a lot of work, or I couldn't do stuff like kneeling down or climbing upstairs.
But Gilbert didn't want to undergo knee replacement surgery just yet, so his doctor tried non-invasive, state-of-the-art knee braces. This is the Bionicare system, a non-surgical, FDA-cleared device that costs about $1,500 and is usually covered by Medicare and health insurance providers. Dr. David Taylor at Sierra Pacific Orthopedic and Spine Center in Northeast Fresno says he prescribes the system for many of his patients who don't want to go under the knife.
I would say 8 out of 10 patients that I prescribe it for say they really feel a difference with the system.
Bionicare works in 2 parts. During the day, the braces take weight-bearing pressure off the worn part of the knee and redistributes that pressure to the thigh muscle and the lower leg. That allows the knee joint to gradually realign, relieving pain. Dr. Taylor says the results can be dramatic.
You have good balance with your legs as you move. Your gait, your stance looks very, very good.
Gilbert and other patients with the Bionicare system can wear the brace practically all day, but it's the therapy at night that makes a big difference, relieving pain and pressure while they sleep. Gilbert shows us how the bionic part of Bionicare happens at night.
And you wrap it around here, then you just go until you start feeling it.
That sound lets Gilbert know electrical pulse stimulation is being delivered to the knee area, as illustrated in this animation video provided by the makers of Bionicare. Dr. Taylor says the pulses help stimulate nutrition around the joint, improving circulation.
And the patient will wear these electrodes with a night wrap at night while they're sleeping for about 8 hours. And I found the combination of the unloader brace and the night wrap is pretty successful in alleviating the pain of osteoarthritis in about 80% of patients that I prescribe these braces for.
I was sort of skeptical at first. I mean, what are these things going to do for me? But man, after you start using them, you'll notice the difference.
That difference encourages Gilbert to take the stairs instead of an elevator.
So this is a beautiful part right here. I had to hold the rail coming down.
And spend time with the people he loves the most.
When I go to the park with my grandkids, I go up there and I move around with a ball and I do stuff.
And that makes this grandfather healthier and happier. In Fresno, Margot Kim, ABC 30 Action News.
And Gilbert also says since using the Bionicare system, he no longer takes medication for arthritis. Doctors say the braces can enable patients to function for years without knee replacement, avoiding the downtime and physical therapy that typically follows surgery.
And he seems happier through all of that, doesn't he?
He really does.